All right, I think that's about everyone. Good evening and welcome to our Careers in Health IT series. My name is Michelle James and I'm the Senior Director of Alumni Engagement at the Rollins School of Public Health at Emory. We are thrilled to have you joining us tonight. The series was created in order to help people explore career paths that exist in the growing field of health IT and connect you with professionals already working in that field. In our previous 3 sessions, we've explored the role of health IT in the federal and the healthcare sectors. And tonight, we're going to discuss the role of consulting within health IT across a variety of sectors: healthcare, government, and private business. Before I introduce our speakers, I would like to take just a few minutes to ask, what is it that you're hoping to get out of tonight's session? So if you would, just take a few minutes and share your thoughts in the chat. We'll be monitoring the chat throughout the session, but we'd like to really know, what is it that you're hoping to gain from joining us tonight? You're giving us an hour of your time, so let us know what you're hoping to walk away with at the end of that hour. We'll definitely, like I said, monitor the chat, so any questions that you have throughout the session, you don't have to think of everything right now, but as they arise, go ahead and type them in, and we'll make sure we address them at the Q&A at the end of our discussion tonight. So over the last decade, health IT has expanded into several fields as technology is ever changing. It is no longer a field with a single focus. The health IT ecosystem now includes digital health, population health, telehealth, cloud management, consumer experience, consulting, and probably by tomorrow, 15 different additional sectors. So I'm assuming that most of us want to talk about consulting tonight, but I'm going to go ahead and put up a poll to find out what area of this ecosystem you are most interested, or currently, if you're already working in. Oh, look, we've got some variety. Okay, I'm seeing digital health, population health, but consulting is overwhelming. But there's consulting within, it's kind of a trick question because there's consulting within each of these sectors as well. But this will just give our panelists a little feel for who we have with us tonight. Okay, so it looks like number 1, consulting, no surprise there. Number 2 would be population health, 3, digital health, followed by telehealth, cloud management, and the consumer experience. Great, thank you so much. So one thing I hear from students and alumni who are considering careers in consulting is that they believe others might judge them for maybe not taking a more quote unquote traditional role in public health, maybe one that's focused on the hard sciences like an epidemiologist or academic research. And so I'm curious if any of you have these concerns. Our panelists are going to talk specifically about this tonight and some of their own tensions and internal struggles that they've dealt with. They're going to talk about the good, the bad, and perhaps even the ugly of a role of consulting. But I want to assure you that if you choose to go into consulting, you are not choosing a path that is what's the word I want, lady? That is not a great path, because it is, and that's what we're here to talk about tonight. So let's meet our panelists. Keisha Hunt is a 2003 behavioral science and health education graduate and is currently the president and CEO of Meta Solutions. She runs a professional services firm here in Atlanta. After spending most of her career directing, evaluating, and administrating large-scale and innovative community-based programs that strengthen organizations' abilities to advance disease prevention as a consultant at 2 other large consulting firms. Kelsey Patel is a 2007 EPI graduate who has worked in public health for almost 4 years now, mostly supporting projects in the National Center for Emerging and Zoonotic Infectious Diseases at the CDC. In 2017, Kelsey initially joined Northrop Grumman as a public health analyst, but in January of 2020, she transitioned over to Booz Allen Hamilton. More recently, she has supported the EOC at the CDC, deploying for 4 months to the Vaccine Task Force and continuing to support the COVID Electronic Case Reporting, or ECR team, within Data Analytics and Visualization Task Force at the CDC. Aditi Arora is a 2008 Health Policy and Management graduate. She is currently a software implementation consultant for a revenue cycling consulting firm, Claro Healthcare. In that role, she focuses on clinical documentation improvement. She leads implementations of the firm's legacy software applications for hospitals. And she is building a software application that is leading the quality assurance testing as an agile development process. Previously, Aditi worked in telemedicine for a firm where she supported implementations of programs to expand access to specialty care across the country. So without further ado, I'm going to turn it over to Megan, one of our current Rollins students who is serving on our committee to create this series. And I'm going to let her introduce herself a little bit and facilitate our discussion tonight. So Megan.
Thanks so much, Michelle, and thanks everyone for joining tonight. For those of you who don't know me, I am a first-year GLEPI student at Rollins. And thanks again, Keisha, Kelsey, and Aditi for joining us today. I think it would be great to hear a bit more from each of you about your background, your time at Emory, your public health interest areas, and then more about your current roles and kind of what is your day-to-day, what projects are you focused on? So I think we have your slides lined up in that order, starting with Keisha, then Kelsey, then Aditi. Keisha, if you just want to take it away, that would be awesome.
Well, good evening, everyone. I hope you can all hear me. I'm very proud to be here, especially with these other dynamic, talented women on this panel. I enjoyed my time at Emory very much, and so it makes me feel good to be able to tell you a little bit about myself and contribute to your career search and your research into consulting. I tried to give a sort of holistic view of what it means to do the work that I do, because every single solitary day is different. I try to start my day getting my mind organized, honestly. Maybe that's the behavioral scientist in me, I don't know, but I feel like if I start my day really thinking about what I need to do and getting my mind at peace, then I do a lot better. Most weeks I have a slate full of meetings, and they range from client meetings to leadership team meetings, to individual team meetings with my staff, with people on my team, people on projects, our recruiter, things like that. At this stage of my career, I don't do as much direct client delivery as I used to. I spend a lot of time making strategic decisions and brainstorming to help my teams to do the client delivery. Our primary client is the CDC. And so we are in the throes of public health. We are also in the throes of the COVID response for a couple of our teams. And so most days are pretty jam-packed with a lot of interaction and a lot of problem solving, and looking at it from not only a business lens, but a strategic lens and also a public health lens. And then I would say the other part of my life is about client service. That I think that's the core of consulting, is really about client service. How are we serving our clients? How are we solving their problems? And how are we turning a profit in doing so? So I think, I tried to include the things I do Mondays, Tuesdays, Wednesdays, Thursdays, and Fridays, but it's also Saturdays and Sundays because I am a small business owner. I work for myself. And so I work a lot. It honestly doesn't bother me because some days are 2-hour days and some days are 18-hour days. And it really is about the way I structure it and the things that are top priority to get done that day. And I think that's something to think about when you're going into consulting. There are definitely some highs and lows in terms of how busy you might be in a certain season or in a certain day. and that flexibility and sort of lack of predictability suits my personality just fine. I do think it takes some getting used to when you first get into consulting, because sometimes you're working 7 days a week and not everyone wants to do that. And I think that's okay. But it's something to think about when you, if you're starting a small business, if you're working for a startup, or if you're even in an industry like public health, where you might be in the middle of a pandemic and there's not necessarily a 9 to 5 day. Megan, did I give you what you needed there?
Yeah, absolutely. Thank you.
Okay.
Do you want to give maybe a little bit more flavor too to the kinds of projects and work that your firm really focuses on?
Sure. So my firm is small. We have about 50 people. We work all over the United States and globally, but we are very focused. We work in public health, capacity building. If you think about the slide we just saw, it's primarily population health. And then we also provide information technology services. And that's everything from building actual IT systems to maintenance and operations. We work with grantees. We work with state health departments. We work in emergency response and global health. We have a team that deploys probably quarterly, or at least they did before COVID, to do, I would say, emergency management trainings overseas and in international communities. We also work on strategic initiatives like vector-borne disease strategy. And so it's a range of work, but it is very focused in terms of public health, capacity building, population health support, and then using information technology as an enabler to move public health forward. So we've got some high profile projects, we've got some high risk projects, and then we've got some stuff that's also like really small with one person on the team, but also really cool and really interesting. So it's quite varied. We don't do engineering, we don't build buildings, we don't do people development. We are heavily focused just in public health and IT.
Wonderful. Thank you so much, Keisha.
You're very welcome.
I think, Kelsey, your slides are up next.
Yep, absolutely. And I will just say, you might hear my cat in the background. He has no boundaries, and this is his active talkative time period. So I can see him up to no good out of the corner of my eye. So you might hear him. I want to kind of echo what Keisha said. I don't think I've worked a 40-hour week for over a year now. I think it's largely due to the pandemic and being in the thick of it with my role currently. I also think it's part of the consulting world as well. And so I'm interested to tease out, once the pandemic dies down a little bit, where that line really was. Was it pandemic? Was it consulting? How much of each? And one thing I realized, was kind of missing from this slide, I didn't include any work-life balance or anything about how I keep up with my life outside of work. And I think it's also because I am still trying to figure that out. It's pretty difficult. Like Keisha said, I also haven't worked just 5 days in a work week for a long time. So finding those pockets of balance, I think, is really key. Whether it is, leaving early for an appointment or just going for a walk, it's really essential. But for this slide, it's really a snapshot of what my current work week looks like in terms of the high level projects I'm supporting. The project at the top, the ELC Health Information Systems, that's my #1 project currently in NCEZID. Along with that, there's also the Emerging Infections Program, monitoring efforts, that's kind of included in there as well. I've included some COVID specific work, which I know was kind of in my bio, of working with electronic case reporting and the vaccine task force. That's still some things I do on a weekly basis or even daily. There's also some data management involved. I know we'll get into that more with specific roles and where that falls within health IT. There's also some data visualizations, using Power BI for us, implementing APIs as well. And then I did want to add in the firm-wide activities aspect, because everything I just spoke to is all on the CDC and the client delivery side. And since I'm early on in my career, I am really focused on client delivery. That's really my 24/7 role. But there's also additional, working for Booz Allen, there's also additional efforts that you should be involved in. That includes proposal efforts. I don't know how many of you have had experience with other contracting or consulting groups. Previously at Northrop Grumman, they had proposal teams separated out from the client delivery people. So I never worked on a single proposal during my time there. The minute I got to Booz Allen, the first thing they said was, you're kind of expected, everyone in the firm is expected to take part in the proposal efforts because you are delivering the work. You're the best to speak to the content and to grow the business. So that's a big part of kind of my day-to-day or week-to-week that is not really billable hours. It's not the CDC client delivery work. And then also I'm part of the Diversity, Equity, and Inclusion Committee. Again, it's a volunteer organization. It's a lot of extra time and effort. I'm really quite proud of it. We've done it since I joined Booz Allen in January of 2020. It really was non-existent. So it really was 3 of us that started it, and we've grown it really quite large. And that's, again, something separate outside of client delivery. And then I will say another just small section is admin. Whether you like it or not, you're going to be scheduling meetings, you're going to be emailing, doing some outreach. I'm not like Keisha, I don't have an assistant, not yet. That's a life goal, Keisha. So that's really kind of an over my work week. And then Megan, anything specific to add on here?
That was such a great overview. Thank you. That was perfect. I think I have so many more questions for each one of you that we will totally get to in the Q&A. Thank you, Kelsey.
Absolutely. And I do want to preface, this is just my personal experience with one federal agency, right? And one consulting company. There's, you don't have to, if you don't like what I'm presenting on, if you don't like some of the areas, there's definitely opportunity to get involved in health IT and in consulting without going into these areas.
Perfect. Thanks, Kelsey. And I think last but certainly not least, Aditi slide.
Thanks so much, Megan. Hi, everyone. It's so nice to be here with you today. Really excited to be on this panel. I certainly haven't had a traditional public health career path, even before I got to Rollins. I actually started off as a behavioral therapist with kids on the autism spectrum for a few years. And in that role, I really developed a passion for health technology because I just began to realize how much of a positive effect that it can have on streamlining healthcare. And when I started at Rollins, I knew that I wanted to study health management. I knew that I wanted to pursue a career in technology. I just didn't know what that career was going to look like or how I was going to get there. I did an internship and a work experience that was focused in health technology, but there are so many various opportunities out there under the healthcare IT or healthcare technology umbrella. So like Kelsey said, if what I'm saying doesn't interest you, I'm just trying to share my perspective. I think the work that I'm doing right now is also a little bit non-traditional, but there's plenty of various opportunities out there. So currently, I work for a revenue cycle consulting firm called Claro Healthcare in their clinical documentation improvement practice. For those of you who may not be familiar with the word clinical documentation improvement, CDI is how accurately a patient encounter is documented in the medical record, and if that documentation reflects the true picture of how sick a patient is. And this is important because it determines the amount of reimbursement a hospital receives. So if there are discrepancies, insurance companies will reject claims and a hospital won't get paid. Or if the record doesn't reflect how truly sick a patient is, a hospital won't get reimbursed fully for the true amount of resources that were spent on that patient, which can really threaten the financial stability of a medical institution. So we focus on helping hospitals expand their CDI programs through using a holistic approach, which incorporates a hospital's people, processes, and technology needs. I work on the technology team within the practice, and we have some homegrown software applications that I help manage and develop, and then I also implement them alongside our business consulting services. The team that I'm on is multidisciplinary. We have product owners, product managers, database architects, developers, data integrity specialists, a security officer, a scrum master, and then there are a few consultants like me. I often collaborate with the product team, but I also collaborate closely with our finance and clinical team members. We are a small firm, less than 250 people, so everybody knows each other, and we all have to work very closely because in order for projects to be successful, each team can't operate in a silo. Teamwork truly does make the dream work. So my day-to-day work varies quite a bit, but a large portion of my work is focused on client support and management. Sorry about the background noise. That's actually the CTA train that you're hearing. But one part of the client support and management is new client projects. This is where I do a lot of that cross-team collaboration. I usually function as a PM overseeing the implementation of our various software applications. That involves understanding a hospital's current process, working with them to develop a new one through some process mapping, being able to explain the data and software deployment specifications to their IT team so that we can do the technical build on their server, set up a HL7 data feed, and set up our application. It also involves doing software demos with the client and then user training as well. So there's a lot that goes into each project implementation. And once that phase of a project is over, we continue to nurture that client relationship and really provide them with ongoing support. For me, this means supporting software applications that they're using, monitoring their program through the data that we receive from them on a monthly basis, managing the data ingestion process, making adjustments to the client's process or their software customizations in whatever application that they're using as their program progresses. And it also includes user support. So I get a lot of phone calls, a lot of emails directly from clients. And when any kind of technical issues pop up, sometimes it's an easy fix, but sometimes it requires working with the developer. And that kind of moves into the other part of my role, which is product development. When there are technical issues or updates that need to be made, which require developers' time, I'll work with them to push out any technology patches as needed. I definitely did not come into this role with a technical background, so working with the product team was a steep learning curve. I still don't know all of the technical details, but I have to understand it to a point where I can understand the problem. I can work with the developer on a fix. I can work with the product owner for approval, and then ultimately work with whoever the end user is to make sure that it's what they want, or if it's an issue that it was actually fixed. Currently, we are working on building a new application, which involves a lot of steps on the right, as you can see. I'm not involved in all of these, but I get some exposure. Where I really step in is leading the quality assurance testing, end user testing, and user training pieces, which could again be internal or client facing. But when building a product, whether it serves an internal team or a client like a hospital, testing it to make sure that it works and the UI and UX functionality is working, the data that the client sees is accurate and is accurate every single time is highly, highly important, and one of the key parts of the product development process. And yes, I know that was a lot of information, but that just kind of touches on some of the different areas of my job that I work on kind of daily.
Thanks so much, Aditi, and all for walking us through your kind of day-to-day at a high level. I think it's really incredible the variety of projects and focus areas and partners you get exposed to when you work with a consultancy firm. I think next up we have some time for Q&A with our panelists. So if anyone has questions, please go ahead and drop them in the chat. We'll be monitoring that. And we're also going to have some time at the end of this session. You'll have the opportunity to talk to our panelists one-on-one. And if you have any remaining questions, then you can also ask them then. But I do have some questions for our three panelists to kind of get us started. So I was thinking we could open this up, just have a conversation and kind of talk through these and get more of a flavor about coming from Rollins. What was it like to enter this world of consulting and what lessons you've kind of learned along the way? So maybe we could just kind of take turns starting with this first question about when were you first introduced to health IT or health consulting? And after that, kind of what was the pathway to realizing that this was where you wanted to go? And maybe Keisha, we could start with you. Or
I was going to say, which one of us do you want us to start? Okay, so I've been running my business for 6 years. So the last few years has definitely been different. But I started my career actually at Booz Allen Hamilton, where Kelsey works now. I was recruited right out of graduate school. And I did not have any intention of going into consulting. I actually sort of fell into it. Booz Allen's a fantastic company, and I stayed there for over a decade. And so I would say that the majority of my career was spent really on the public health side of IT projects. And I liked that a lot, especially in the early years of my career when the business was being built, the public health business at Booz Allen. I was often brought in because I was one of the only sort of public health people in the company. And so they really needed a marriage of kind of the technical expertise as well as the public health knowledge and experience to think about what the holistic solution could be for the client. And so that you're not just sort of doing one piece without incorporating the other, because you need the IT mind as well as the public health mind to really do health IT. I think, the examples that everybody gave today really show that it's a combination. It's not really just one set of expertise or skills. These are multidisciplinary teams. But I think one of the things that I just really liked was the problem solving aspect of it, is that when with the government especially, they're coming with an actual challenge. They're coming with a system that needs to be built. They're coming with oftentimes a program that needs to get off the ground, and they need actual help and they need actual contributions. It's not something that you're doing just because. And it's a really cool idea that can turn into an actual system that's being used. I think one of the examples that I would give is a current project that we have, which is supporting the Vaccines for Children program. And so our team, Vaccines for Children program, distributes free and low cost pediatric vaccines according to the schedule for low income and certain ethnic populations across the United States. And so we provide the operations and maintenance for the system that supports the site visits for the providers that are actually implementing the program in their states and territories. And so, if that system breaks down, then you don't necessarily know, you don't have insight into vaccine storage, you don't have insight into quantity, you don't have insight into availability for patients. And so, it's exciting to be part of that, to know that you're contributing to something that has actual public health impact. And that's, I was concerned about that when I first started my career. I wasn't sure I was doing public health work. And then it became apparent that you actually are. It's just a different part of the public health ecosystem that you're participating in. And I love it. It's fun to solve problems. It's fun to have your clients walk away feeling like you help them get somewhere. And so I would say that's probably why I stayed, is because I felt like I was making an impact. And now that I'm running my own business, I get to have a little bit more autonomy over the projects that we choose. And as I said before, we do public health work. That's all we do. And so it's really nice to narrow your focus, because at one point, I think I kind of felt like a jack of all trades, master of none. And so now we get to just do the projects that really feel like we're making an impact. public health.
And I can go next. And Keisha, you took the words right out of my mouth. I was going to say I fell into health IT consulting. I came to Rollins straight from undergrad. I was a biology major. I was pre-med for 3 of the 4 years. I was entering into my senior year and decided I didn't want to be a doctor, but wanted to work more at the population health level. So on a whim, applied for grad school, went. My time at Rollins, I definitely was interested in surveillance systems or just general health information systems. I was interested in infectious disease, epi, in global health. Really, there was just a spectrum of interest. And so I really just like, okay, let me focus on getting that first job out of Rollins. Let me focus on getting started in the public health world. And then I can go from there and grow my interest and figure out what I really do want to do long-term. So fell into it that way. Started north of Grumman, started with the same project supporting NCE's AID. So I have been doing that work for my 4th year now for the same project. But I do want to, echo what Keisha was saying about, actually, I want to thank you, Keisha, for building Booz Allen's public health work so that I could benefit. I think that is super key. And I can imagine being there at the ground level when it wasn't as public healthy and Booz Allen wasn't known for the health sector. Like I can't imagine trying to stay true to your public health roots and still try to grow that business. So thank you. I think I'm benefiting from that, and everyone else working in health at Booz Allen right now is benefiting from that.
Thank you. That was very kind.
Yeah, absolutely. And I will say, trying to do more, right? There's several small groups within the firm itself that's trying to figure out how to make Allen more competitive in the public health space, how to go after targeted, truly public health focused projects, whether that's qualitative or quantitative data now, analysis, really applied public health. I think I'm one of the lucky ones at the firm where I get to work in a center that I'm interested in a division that I'm interested in, with really great clients, and have a lot of autonomy. I have a lot of call over, the data that we collect and how it gets analyzed and how it gets presented. And I think that can be rare depending on who your CDC client is. So I will say you kind of have to get started and just see what the environment is like, how much, leeway you have with working on different projects, and how much you can really get away with a lot of the kind of knowledge and data that's captured, and how much of it is truly just you delivering services to the client. So it's been an interesting health IT journey. I will say for Booz Allen, I think you do have to, they tend to hire public health people, definitely Rollins students, but you have to at least know or have an interest in the IT section and how to make it more holistic and well-rounded. If you don't know the skill, show that you can learn it, or demonstrate that you're willing to learn it, or at least speak the same language as the developers, and be able to kind of bridge the gap, kind of do a little bit of business analyst work there as well. So I would encourage you, if you are, strong public health, but really want to get into the health IT consulting space, to also maybe add some of those, maybe 1 or 2 programming languages, or some interest around IT to really kind of round out your portfolio and make you really competitive in this business.
I think it's really interesting, Kelsey and Keisha, that you both said that you fell into health IT, because it was definitely not like that for me. I did not fall into this career path or consulting. I knew right from the start, when even like pre-Rollins, when I was a healthcare provider, I knew the importance of technology and how it can streamline care and make for a more positive patient experience. And I wanted that so bad. Since the day that I started at Rollins, and I found it to be extremely difficult to pave my own way and kind of navigate this industry and find career opportunities that really suited my interests. For me, I personally have a strong interest in finance and operations. I definitely have more of an interest in the business side of healthcare organizations. And, while I was at Rollins, I was getting exposed to so many different like potential consulting career paths. And I kind of knew early on that the federal consulting path wasn't going to be for me. Personally, I had interest in finance and operations because something actually one of my finance professors said to me. He said, without a margin, there's no mission. And to me, that kind of became my passion. That's just always really stuck with me. And I saw that as a form of public health, because finance and operations are the foundation to keeping any healthcare organization, specifically hospitals, open so that communities can access healthcare services. And that same strong foundation also ensures that any technology or digital health initiatives implemented are successful. So I think my interest path was just a little bit different. And I know the career path I took isn't like your traditional public health path, but I find a lot of purpose in it. I find a lot of value in it. And through my day-to-day work, I do feel like I'm making an impact on the community, especially during the pandemic, seeing hospitals' financial statements and, seeing those high mortality rates and, seeing hospitals that are safety nets and serve a high percentage of Medicaid population patients, if they close their doors, where's that community going to go to find healthcare? So I think public health IT is so broad. It can mean so many different things, but if you find purpose in in a specific thing or a variety of things, it's definitely worth exploring.
Perfect. Thanks so much. I think before we move on to the next question, I wanted to call attention to some comments in the chat. The first one, do health IT firms provide sponsorship for international students? So do you three know of any opportunities for international students, either within your firm or when you were a student, when you were researching, anything there?
Can I ask a clarifying question? Does sponsorship mean like a visa sponsorship? Or just do we hire international students? Do we do internships? Maybe elaborate on the question just a little bit so I can answer it properly.
I think it says yes, like an H-1B.
Like an H-1B. Yes, so I can speak for Metis, for my company. We have done that before. The contract has to sort of allow for it. Anytime we hire, we are following the contractual obligations, meaning sometimes citizenship is required. It depends on the work, especially if there's a certain clearance level that has to be obtained. The degree requirements, years of experience. Sometimes there's a language requirement, meaning, especially if it's an international health project and you're going to certain countries, and they may want to. Usually, Spanish and French are the most common, but we really just follow the guidelines. And if there is enough in the contract budget to sponsor an H-1B or something like that, because that is expensive. And if there's a long enough contract, right? Because there are certain employment requirements that go along with those. Like you have to be employed for a certain number of years. And if the contract's only 6 months, it might not fit. So we just have to make sure the hiring and the candidate fit the contract requirements. So I guess the answer is yes, but it kind of depends on what the situation is.
Yeah, I'd agree with that, Keisha. And I think it also, you might want to try at some of the larger consulting firms like Northrop Grumman or Booz Allen or Deloitte. I think they have a long history of sponsoring international workers and have probably the ability to do so more so than some smaller companies. But yes, I think it's definitely something that's a possibility. But like Keisha said, fit matters, and then in the contract as well. For example, my current CDC contract before COVID, we had no telework in our contract. So I had to show up at the client site every day. And actually, we were unsure for a while if we would get telework privileges. It was March 2020. We were still waiting on the green light if we could work from home. So that's a small example of you have to follow your contract to a T, whether you like it or not, really.
Thanks so much, both. There's another question. Could you talk a little bit about how public health IT consulting firms find projects and clients? So maybe touching on some of the new biz you were hinting at earlier.
Do you want me to take that one?
So Keisha, you start from your business perspective, and I can maybe give the Booz Allen.
Yeah. So it varies. Sometimes, so we're an 8A certified small business. So we're 8A certified and also a woman-owned small business. And so when you have an 8A certification, sometimes you are eligible for what's called a direct award, which means the government can come. So I'll preface this by saying my clients are federal government agencies. Some companies work with commercial clients, and they also might have hospitals or pharmaceutical companies or private industry as their clients. And so every health IT company is not the same. My company works with the federal government, primarily the CDC and HHS, which is obviously the larger umbrella agency. And so sometimes the government comes directly to us and they go, you're a small business and you're 8A certified, and this contract is under a $4 million value. So we're just going to, hey, can you do this work? Prove to us that you can do it. Submit a proposal, submit a quote, and then the work is yours. Those are my favorite because there's a little bit less of a proposal effort to go through and it's not competitive. Other times we go out into the open marketplace and we compete for work that is posted and and we're aware of it, and we're competing with other companies that are our size or that are larger. And then there are times when I already have a client relationship and that person may come to me and go, hey, we've got an issue here that we need to solve. Can you come work with us and solve this particular problem? So business comes in a lot of different ways. We also have teaming partners. We team with Booz Allen. And so sometimes we'll come to them and go, we have this opportunity. Can you team with us? Or Booz Allen will come to us and go, hey, there's a small business opportunity. Will you team with us? And we will go out and compete for it. So business comes in a lot of different ways.
Yeah, thinking about, what to add to that, Keisha. I think I mentioned it earlier, but if you do end up working for Booz Allen, you will be involved heavily in those business growth and capture efforts and in the proposal work. There's also a strategic innovations group at Booz Allen who, the SIG, who do a lot of the research, and they create or write a lot of white papers. I've helped out a couple times on some of their efforts where they are more forward thinking and trying to forecast where the industry will go, what gaps Booz Allen, what gaps exist that Booz Allen needs to be able to fill if they want to remain competitive. And then that kind of shapes what work they go after as well as a business. From the small health bubble and really just focused on CDC, a big part of our business growth is that what Keisha mentioned about the relationships you have with your clients. I think COVID is a great example. We started, this January of 2020, Booz Allen started a brand new contract that I was a part of. It was very limited. There's 9 task areas, very specific. And then COVID hit. We'd already proved that we could do good work for, the first 2-3 months. And then all of a sudden we're just getting contract modifications, or we're telling the CDC client, hey, we think we could provide some really great data analysis and visualization. We've got great people that could lead these efforts, or, this team is small. It could really benefit from 2 to 3 more people. So if you want them to be able to continue to do the great job they're doing in a pandemic scenario and also deliver above and beyond, we need to grow our team. So it's really maintaining those relationships. And then also, you kind of have to sell yourself. You're constantly marketing your firm. I'm often in conversations, and sometimes I'll just kind of drop a line of like, oh, I have some, teammates or Booz Allen teammates that are very familiar with this work if we want to, set up another discussion to talk more about it, because you never know if that'll turn into a new contract and new business for the firm. So you kind of always have to be on the lookout for opportunities. So you have to know what your firm currently does and offers, and then what the skills are of the people that you work with as well, so that you can really sell. So it's a little bit, it's a bit intense that way. And I will say that's for me was Booz Allen specific. At Northrop, I had a completely different experience. I was not nowhere near the proposal efforts or having any conversations about business growth and how I could get involved. So I will say it does depend on, the company that you do join.
I guess I can add some perspective from private sector. I honestly do not have a lot of involvement in business growth, but I am aware of some of the ways that we do get some new business, and we have several long-standing clients who've been with us for over the last 10 to 15 years, and they've been with us since we did just financial consulting services, and we did manual reporting before we had all of the technology, and there was an opportunity there to get them on board and have them use our new technology and see improvements in their processes. And then we also heavily rely on client relationships. Sometimes we'll work with one hospital and we'll develop really good relationships with the C-suite executives there. And then one of the C-suite executives will move to another hospital system and they'll be like, oh yes, that firm, we need them. We also have a lot of very in-depth marketing efforts. So there's a lot of public data available out there. And from CMS, we use a set of data called MedPAR. And it's basically a bunch of data on Medicare patients. So we can analyze how these patients were final billed, how long were they in the hospital, what was their severity. And so we can analyze all this data for specific hospitals or for the region that they're in, and we basically show them, sometimes without them asking us, when we're trying to pursue them, we show them this is where you stand in comparison to your main competitors in your region, and this is like where you could be standing. And we will pursue clients that way, or some clients will reach out to us, but in that case there is like a vetting process, because usually hospitals are always considering multiple consulting firms. But I think what my firm kind of brings to the table that's a little bit different is when we implement projects, we don't just leave after a few months and hand them a binder. We really focus on the client relationship management and the ongoing support for over a decade for some of our clients. And I think hospitals really appreciate that, because consulting services are not cheap, and hospitals want to see a return on that investment, and they want to see an impact for their patient population.
Thanks all, and I think we just have a few minutes left, so we're going to move to our last question before we head to our breakout rooms. Do you have any takeaways or words of wisdom or resources for our attendees to consider today as they kind of pursue careers in public health? I'm sure we have some second-year students who are nearing graduation, so we're thinking about that. But anything you've heard that's kind of stuck with you or helps you stay positive when you have these really long weeks and days?
I have a couple of takeaways. The first one being, if you are wanting to pursue career in health IT specifically, you don't need to be technical. You don't need to be a developer or a database person or a SQL R expert. I mean, unless you want to be, then definitely go for it. But if you don't want to be, it's totally okay. You might need to know some basic SQL and Excel analytics skills going in, but definitely don't discount those soft skills. I mean, I hate the word soft skills to begin with, but things like organization, attention to detail, listening, compassion, empathy, being a team player, these things go a lot farther than you think. And second takeaway, if you would like to do consulting, don't limit yourself to the big and the well-known companies. I think I made this mistake, and I thought in order to do consulting, I would have to work at one of these firms. But I'm working for a startup right now, and I think it's been one of the best choices I ever made. I really like the connections that I've made within the firm. I have a lot of partner exposure. I get to present and speak directly to C-suite executives at hospitals. I get to wear many different hats, and my managers are heavily invested in helping me grow and learn a lot of the technical skills that I didn't come in with.
Yeah, I think that's great, Aditi. I think technical skills, great. You do have to be flexible, whether that's in learning new skills or being willing to learn new skills or being thrown into projects. That happens quite often. But the number one skill that I will take with me everywhere is communication. Whether that's with clients or small scale, trying to communicate with a developer about how you want your data visualized or how you want your data stored and what outputs you want. I agree, it's not a soft skill. It's a pretty strong one, but it's not technical. I'll also say, I think I mentioned this already, but it's a wide spectrum of health IT. So even if you get started in a company, in any given company and you don't like it, it might just be that company. And it might just be that specific role that you're in. It might not be health IT as a whole. So give it some time, or, talk to others who have, different experiences. And then also let people know what you're interested in and what your skill sets are. Even within Booz Allen, I've let, people around me know, like, hey, I don't want to be on this project forever. Here's what I'm interested in. Here are my skills. Let's keep in communication. So if something comes up, I can help. And I think that was a piece of advice that somebody gave me when I was in Rollins, or at Rollins as well, is just tell people, especially when I was trying to find, a thesis or a topic, tell people what you're interested in. They'll start connecting you with others. So I've kind of carried that with me in my professional career as well.
So I think what I would add to that is to do your homework on the companies that you are interested in working with. Like Aditi mentioned, I also run and work for a startup. And so if you don't have the temperament to work for a startup, then try to make sure you know that before you start either applying there or you start working there, because a 10, 15, 50 person company versus a 10,000 person firm is going to be a very different experience. And both could be wonderful or both could be awful, depending on what you're looking for in terms of your environment for your career. And I think that's important. You can read reviews on Glassdoor or salary.com, but I think the Rollins network is tremendous in terms of networking and people who are super generous with their time and with their expertise. And so if you find someone who's an alum who works in that company, they can really tell you what it's like and what the transition has been like and what they're doing and if they like it and why they like it or if they don't. And you can figure out if it's a fit, because the fit has to work both ways. You have to fit the company and the company has to fit you. The other thing I would add is I think the part that sometimes we underestimate is the importance of relationships. And I think Kelsey mentioned this earlier when talking about client relationships, but I think professional relationships are hugely important. And so making sure that when you get into your career that you're building relationships and building mentorships and peer relationships and understanding what it means to be a really good team member. I heard someone give a colleague that advice early on in my career. We were peers and she was talking to someone who was brand new. And she said, we talk a lot about what we want from companies, but never underestimate the importance of being a good teammate. And I think sometimes it takes some time to figure out what that means, not just what you're getting from a project, but what you're giving. Are you available? Are you communicating? Are you giving your best effort? Are you miserable on the project and you haven't told anybody? And so therefore you're not a good teammate, because every team will be different, every client will be different, and every project will be different. And sometimes clients are awful. Sometimes they're mean. Sometimes they're not very smart. Sometimes they're not very innovative. And so, but you still have a job to do. And so understanding that and understanding your role on a team, I think is just hugely important in a consulting environment. And sometimes that means gritting your teeth and pushing through to the end so the client gets what they need so you can get away from them and go to a really awesome project.
Thank you. I think collaboration is everything. We preach it at Emory, and it's great to see that you guys are doing that in your jobs as well. So I think now we have time for networking in our breakout rooms. Michelle, are you able to facilitate those?
I am. So for those of you who would like to stay, I've gone ahead and broken up into 3 rooms with each of our speakers. So you can ask any additional questions that you may have for any of them, as well as network with one another. I want to just thank you all for attending tonight, and I hope that you'll come back and join us again for another session. We're always looking for ideas and what you would like to hear about. So if you have those, please feel free to share them with us, and we'll keep you posted on our next series. I want to also thank our speakers, Keisha, Aditi, Kelsey, thank you so much. And Megan, as always, you did a great job facilitating, so thank you so much. All right, here we go to breakout rooms. 10 minutes, okay?